Yeah, Nitin, you may start now.
Okay, Satish, we'll start. Start. So, it's an absolute pleasure to welcome you all to the insightful webinar. Before we start today's discussion, allow me to introduce Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver innovative and superior products. Hetero Healthcare has established 300 products in the portfolio. We are pioneer in quality and innovation. We have launched 4 biosimilar products in the market in last 5 years. We have a global presence. We are operating in 123 countries. So it's a true multinational company. So as you all are aware, today's topic for today's webinar is missing link in your enzymatic preparation. To shed the light, we are privileged to have Dr. Satish Kumar Menon with us. So welcome, Dr. Satish. So just a brief intro. Dr. Satish Kumar Menon is an MDS in periodontology with 15 years of experience. He is a founder of Kazan Dental and practices exclusively periodontology and implant surgeries in Navi Mumbai. He has published various papers in the field of periodontistry. He has a YouTube channel with 54,000 subscribers. He has authored 2 books, BDS Launchpad and Dental Launchpad. This is a short brief about Dr. Satish. So we welcome you, and I would like to hand over the session to Dr. Satish Menon. Doctor, you can continue.
Thank you, Dr. Nitin. Welcome all. Haven't you always thought that when we have such sessions in the afternoon, okay, even it's just not the young dentists who are eagerly listening in the afternoon. There are even senior dentists among the crowd. We dentists take out time from a busy schedule to come and attend such seminars and lectures. We might be working in the morning and in the evening, and we squeeze this lecture in the afternoon. At times, we take our weekends, the Saturdays and Sundays, and we go and listen and upgrade ourselves. Have you not ever wondered, as dentists, why are we doing this? Why do we put a lot of effort into learning and improving our clinical skills and our dental management skills? So, if you ask a lot of dentists, you'll get a variety of reasons. You can ask yourself what your reason is. You might be in the camp who tells that I am doing this so that I learn better skills, I learn more about dentistry, and in the end, I can get more number of patients. For others, it's all about if my skills are better, I would be able to provide better services and make more money at the end of the day. Money so that I can take care of my family, I can take care of my needs, and I can take care of the society around me. For the rest of the dentists, it might all be about satisfaction and respect. So that when you know the right treatment protocol, the right medications which have to be given, you would be a better dentist at the end of the day. And your patients will after the treatment say कि डॉक्टर ने ट्रीटमेंट किया बिल्कुल तकलीफ नहीं हुई. They'll be absolutely satisfied with your treatment. That leads to respect not just among patients but eventually among dentists as well, based on your skill set. But I want to ask you one question. At the end of all this, we want more patience, we want more money, we want satisfaction, we want respect. What is the bottom line? What gives us all this? It is basically having happy patients walk out of the practice. So when a patient is happy, they will go out, tell other patients that the treatment here is amazing. They would refer more patients to your practice, leading to more patients. More patients, more satisfied patients leads to more income generating activity in your clinic. Once that happens, the patient satisfaction and respect among your patients and peers also increases. So, as dentists, we are doing all this effort to have happier patients. So, this is what we want. But what does our patient want? How do you make your patient happy? There might be an old uncle with maybe a denture in his mouth and he's unhappy with its loose fitting. There may be a young IT person walking into your practice who is okay with her teeth, no pain, no discomfort, but is not happy with the smile and wants to enhance it better. Maybe they want whiter teeth, maybe they want brighter teeth. Then there is this child who is being taken along into the practice. Pain might be her major concern. Whether she's able to chew her favorite food might be her favorite concern. So you have a variety of patients who walk into your practice every day. But have you wondered what is the basic need for them to come into your practice? What do they desire? If there are like three dentists sitting, we would jokingly say, my patient always wants discounts. Forget discounts. I want to ask you one question. Have you seen practices where the charges are absolutely low, but the dentist is sitting idle and does not have enough patients? Whereas, on the other hand, there are practices where the charges are extremely high based on your area, but there is always an overrush of patients in the waiting area. It becomes difficult for patients to get into that practice. So, you have patients who are willing to pay more and wait longer but go to a certain dentist. So, the answer you know yourself is not that all patients come for discount or for the cheapest dental treatment. Then, what are they searching? The next answer might be patients want good quality treatment and service. I want to ask you one question. Have you seen that case done by you or in your clinic where there is a perfect root canal obturated 1 mm below the apex and the patient has pain? In the same patient, there might be another root canal done maybe zillions of years ago, and that is like half the root canal is failed, or there is no GP, and the patient still is pain free. And the patient always tells great things about the previous dentist who did such a root canal with a half filling in their mouth. So patients are not there to judge whether that margin was perfect, whether the obturation was at the apex. Patients don't judge those kind of things. Then what do they want? If they are not looking for discounts, they are not looking for ideal treatment. Patients basically come to us for three basic requirements. One is function. I should be able to chew. Once you do a treatment in my mouth, I should not have any problem in chewing. Second, when I smile, the teeth should look aesthetic. People should say that your smile is beautiful. The second most important thing patients look for is aesthetics. And to top it all, they want function, they want aesthetics, but they are not willing to go through pain and discomfort during or after treatment. For them, the procedure has to be painless or with less pain or discomfort. Why do most patients avoid dentists? It's the fear of pain, it's the fear of discomfort during and even after treatment. Now, during treatment, there are various things you can do. For example, you can learn a good anesthetic technique. You can use nitrous oxide. You can calm the patient. You can do a good injection technique. You can use different injectable materials. So it is basically your skill set which comes into the clinic, which comes in handy, so that the patient has less pain and discomfort during the procedure. But what about after the procedure? One common thing which we have been giving from when dentistry started is painkillers. Why do we give it? Why are analgesics given? It is to reduce discomfort, swelling, and other indications of inflammation which the patient might have post procedure. Now, when I said indications of inflammation, what is inflammation? Why does a patient actually have swelling during or after the procedure? What is the definition of it? It basically means to set on fire. Are we actually setting our patients on fire? But that's how they feel. They feel discomforted because of the pain, swelling, which happens out there. And what is inflammation? Inflammation is basically a body's response to any trauma. It might be physical, it might be chemical, it might be even bacterial or viral. Anything which injures the tissue, it is a defense mechanism of the body to keep it at that area so that it does not engulf the entire body. So inflammation basically has five signs. First is heat, then is redness, then there is swelling, then there is pain, and in certain cases there is loss of function or functionalacia. Now, loss of function is rarely seen as a symptom of inflammation in dentistry. It happens maybe when you remove a third molar or there is infection in the third molar and the patient is not able to open their jaw because of open their mouth because of it. Otherwise, we are commonly dealing with heat, redness, pain, and swelling. The most important ones are pain and swelling. For that, we try and give painkillers or analgesics. Analgesics have some amount of anti inflammatory activity. Now, is inflammation bad or good? In short term, acute inflammation is actually beneficial. So, for example, when you have a cold or a fever, it's your body's inflammatory mechanism which is trying to remove the bacteria or virus, trying to heat up your body so that the viruses which are trying to irritate your body are completely killed. It tries and causes sneezing reflex so that the mucus tries and remove all the bacterial component which is there in your body. So, acute inflammation is usually a body's defense mechanism, but if it lasts for a long period of time, it can lead to any cause severe illnesses from cardiovascular diseases to neurovascular diseases. Even it can cause cancer at the end of the day. So acute inflammation is a body response to protect you, but it ends up causing pain and swelling, and in the long term it can cause chronic illnesses as well. So, the point is, what is this inflammation all about? How does the body react like this? Why does this happen? Imagine you're passing through a particular area and you look to the side. There is a site where an accident happens. Once the accident happens, what do? Few people around there will call the police. Others would call the ambulance so that they would take care of the injured, they would manage the site and take care of the people who were involved in the accident. But there are some people in India, as we know, who would end up calling their friends, their family to come and sight see what is happening. Excessive people who are not helpful will also park their cars and stop there and see what's happening. Similarly, what happens in inflammation is when there is an injury, the surrounding cells tell the inflammatory cells or cells in the blood vessels and the body, come and protect this area, form a seal out here, remove the infection from here. So there are certain mediators which are created. These mediators might already be present in the cells which are in the surrounding area. Those are known as cell derived mediators. Others might be found in the blood vessels which are passing through the site. They are known as plasma derived blood vessels. Now, why did you learn all this in physiology? You will be thinking कि मुझे ये क्यों सिखाया गया है? Why even should I know what is cell derived mediators? Why should I be concerned about inflammation? Why should I worry about all these things? The answer is simple. Majority of the procedures we do in dentistry causes inflammation. Remember the anesthetic prick you gave to your patient today or yesterday? When you were puncturing the tissue, you cause inflammatory reaction out there. Inflammation might have been less because your needle was thin, but you caused trauma. Remember the extraction you did. Remember the patient who walked into the with trauma in your practice. Remember the drilling for the site of implant. Even to close the extraction site, the suturing you did. All these things caused trauma to the site, leading to inflammation. So you want to take care of the inflammation either which the patient already has or which you have created. Why do we create inflammation? We basically do it so that we cause small term harm for long term gain. By removing the tooth, you might be causing short term trauma, but you're preventing infection from spreading, the patient from having a long term discomfort. By drilling the site for an implant, you're causing short term trauma to the area, but you're giving the patient a tooth to chew for life. By suturing that area, you're closing it so that the infection doesn't happen, patient doesn't have further complications, but you're causing short term inflammation and trauma. And if you ask all patients, the two questions will be, treatment करते वक्त दर्द होगा क्या? Will I have pain when treatment is going on? And will it pain after the treatment is done? So just not their concern of what happens during treatment, they are also concerned that after treatment, whether they are going to have discomfort or not. And remember, we discussed in the start, we want our patients to be happy. If our patients are happy, it will solve all our requirements of happy patients, more money, and satisfaction and respect. You remember those patients who tell कि ये डॉक्टर ने दांत निकाला, बिल्कुल पेन नहीं हुआ. That's this doctor removed the tooth, there was absolutely no pain. Whereas the other doctor removed my tooth, it was continuously paining for 3-4 days after that. Which doctor you want to be? I'm sure you want to be the doctor who they said caused less discomfort post procedure. So, why are you depending only on analgesics to control the inflammatory phase and prevent more spread of pain for the patient? In today's day and age, we have to go for the combination approach where we are aware that there are certain enzymes which can prevent pain and reduce discomfort for the patient post procedure. One such medicine is Tolib, and it comes from the brand of Hetero Healthcare. Imagine a multinational company which has medications given across 120 plus countries. They create their own biosimilar products. So this is a company with a product you can trust. So they have come up with a combination of Tolib, which basically has tryptin, bromelain, rutoside, and papain. Now, they are telling us that if you give this combination of four enzymes, it is going to be absolutely beneficial to your patient. But I know you are an intelligent dentist. You're not randomly going to listen to a medical rep and start prescribing. You want to know, of course, I want my patients to be pain free without discomfort. But is this an advantage medication? Giving this enzyme, will my patient benefit? For that, you need to understand the advantage of each of these enzymes. So let's look into trypsin. I'm sure if you read your textbooks in physiology during your first year of BDS, you would remember this term trypsin. It is in the form of trypsinogen created in the pancreas. It enters into the pancreatic duct where it is later broken down into trypsin and it starts its action in the duodenum. Now, this enzyme is already created in the body. Why are we giving an enzyme externally? What are the advantages of giving such an enzyme? The first thing is it reduces vascular permeability. Second, it reduces pro-inflammatory cytokines, which are basically mediators. Now, remember this conversation we had in the start that when there is an accident, the people are calling out their friends to come and sightsee. Similarly, these cell-derived proteins and mediators, they cause the vascular permeability out there. That is, your blood vessels open up so that there is more blood supply into that area, leading to swelling in that area. And what is our patient's discomfort? Increased swelling. So to reduce that swelling, we want to reduce vascular permeability. That is wherein trypsin comes in handy. It also reduces the various cell-derived mediators. The next thing what it does is fibrinolysis. Imagine there is a broken wall in your house. You call the people to repair it. They will come, they will do the entire cementation, they'll make the wall absolutely perfect. But when they are going, they leave all the debris out there, the excessive cement, the mud, the sand, their instruments, they leave everything out there and they'll go. What would be the condition of the area? It would be bad, right? Similarly, when you have inflammatory reaction, you have fibrin activity, basically sealing of the traumatic injury site. The fibrins go there, create a clot and seals up that area. Once that is done, you want that fibrin eventually to be broken down and natural cells to be formed out there. You do not want a lot of cluster and debris out there. So trypsin helps in to go to those sites and create fibrinolysis activity, basically cleaning up all the cellular debris which is there. Now, We know trypsin is advantageous. Second, we know we want to help our patients. But the third thing is this actually effective? Research says us this, but is there research done on patients? And the answer is yes. Our medical colleagues have been prescribing trypsin previously in various conditions like ulcers, rheumatoid arthritis, and even in ocular disorders. And they have found trypsin to be beneficial. So imagine an enzyme which our medical colleagues are prescribing and they have got good results. Why are we dentists not using it to try and comfort our patients so that they have less discomfort post procedure? So now we have understood trypsin is good. But why are we giving a combination of food? Why are we giving bromelain? And bromelain is something which is derived from pineapple. So why would I take something from pineapple and give it to my patients? The answer is bromelain has a lot of advantages. It inhibits pro-inflammatory mediators, it suppresses the immune response, and it also reduces platelet aggregation. So even before the clotlet starts forming, it goes there and sees only as much as clot formation is required, it allows that to happen. It prevents excessive clot formation out there. So with so many advantages, again, we have to look into research whether this enzyme was given before. And the answer is yes. Bromelain has been used in various conditions, including in post injuries. There was a study which was done that if you give bromelain before injury, before a surgery for an injury, the post surgery healing is faster. So when you have an enzyme which is helping our patients, what is stopping us from prescribing it? Moving on to the third enzyme, that is rutoside. Now rutoside is formed commonly in apple and tea as well. Now we are taking a naturally occurring enzyme and giving it to our patients. The reason again is multifold. It has inhibition of platelet aggregation, it decreases vascular permeability, increases the blood flow strength and circulation there, strengthens the capillaries, and it suppresses various mediators like interleukin 1 beta and tumor necrosis factor alpha. Similarly to the other enzymes, has rutoside been used before? And the answer is yes. It has been used in arthritis and in various other inflammatory diseases. So again, an enzyme which we know is useful, which we know how it acts on the body and has been used by our medical colleagues before. The most important enzyme or the game changing enzyme in all of this is papain. Papain is found very commonly in papaya. You've seen those green raw papayas on trees? Basically, they give cuts on those papayas and a whitish layer oozes out. Once that whitish layer which is oozed out, the latex, from that they derive the papain and which is prescribed to our patients. Now, majority of combinations of enzymes have gone and tried and replicated the three enzymes which came prior, but most of them can have not been able to replicate papain. So, why has Hetero Healthcare made an effort to add a fourth enzyme and give it to our patients? The answer is a long list of advantages. First is strengthens blood vessels. Second, anti-inflammatory effect. Third, antioxidant properties. And fourth, improved microcirculation. Similar to the other enzymes, is there research regarding it? And the answer is yes. It has been used in various cases like trauma, sports injuries, burns, diabetic ulcers, leg ulcers, burn cases, and pressure ulcers. So you have seen an enzyme which is effective, then why not add it for our patients? The most important thing is you can give these enzymes separately, one after the other, rather than giving a combination of four. But you remember in your textbooks, you learned something known as the synergistic effect. It's like a team when you might have a good batsman or you might have a good bowler. the chances of winning is average. But when you have an entire strong team together, the effect is more compounded. That is where the synergistic effect of TOLIP comes in handy. Now we have studied about the advantages of each of these enzymes. We have understood that the synergistic effect is helpful for our patients. But I'm sure the curious person in you would be considering, but is TOLIP proven? Each enzyme is proven separately. Should I be prescribing TOLIP? Now, how do you identify whether TOLIP is effective or not? Imagine 10 patients walk into your practice, 5 you give TOLIP, 5 you do not give TOLIP, and you do the same procedure across all the 10 patients. And you see who has better healing. If both the sets of patients have same amount of healing, it means TOLIP is not effective. But if you find better results in a set of patients you have prescribed TOLIP, it proves TOLIP is effective. And we have such a study. The study was being done in Savita Dental College, where they collected a group of 60 patients who needed surgical extraction of the third molar. They divided them into two groups of 30 each. 30 were prescribed TOLIP, 30 were not prescribed TOLIP. And post the procedure, after a few days, they called the patients and they found out. And you can see it, it is clearly mentioned that the use of papain appears to be associated with a reduction of soft tissue swelling and improved mouth opening when compared to conventional therapy, means without TOLIP. So they have done a study across 60 patients. That's a decent sample size to prove that patients who have been given TOLIP have better healing post procedure and surgery. So, what is stopping you from trying and providing your patients better results and better post procedural comfort? Now, your answer will be, I've been confident, I have decided TOLIP is good. I believe you, Dr. Satish, and I want to prescribe it to my patients. So, how do I prescribe it and when do I prescribe it? When do you prescribe is basically wherever you are expecting some amount of inflammation. That is post extraction, post traumatic surgery, jaw fractures, disimpaction, wound. Whenever you're expecting, you want more wound healing. If you have done an implant surgery, if you have done grafting out there, wherever you feel swelling response of the body is going to be severe and you want to control it, you can prescribe these enzymes. Then comes how much do you give it? Usually, my question to you will be, once you do a procedure, how long do you tell a patient the pain or swelling might be there? 5 to 7 days, right? Similarly, you prescribe TOLIP twice daily for 5 to 7 days. 5 days in those cases where you feel it was a normal extraction, normal disimpaction, patient is not going to have discomfort for long. Where you feel it was a more traumatic surgery, where the procedure was more aggressive, you give it for 7 days. In certain cases, you can prescribe it for 10 days. So basically, you prescribe TOLIP twice daily for 5 to 10 days, depending upon how much inflammation or swelling you're expecting the patient to have. Now we know the advantages of TOLIP, we know the dosage of TOLIP. Then we come to the point that should we prescribe it to each and every patient? Are there any contraindications or side effects? Let's start with side effects. Remember your format. When you know the answer, you used to write nausea, vomiting, diarrhea as side effects. And here you have it. With TOLIP, the side effect is similar: nausea, vomiting, and diarrhea. But what about the contraindications? Remember the start, we discussed that it prevents clot formation and fibrinolysis. So imagine your patient is already on warfarin therapy, where the previous medical colleague of yours is prescribed the patient to reduce the clot or increase the bleeding as of in that case. Then you do not want to add an enzyme which would enhance that effect. So if your patient is having warfarin therapy, you should avoid giving TOLIP. The second is if the patient is on certain sedatives due to psychological disorders or other reasons. The third contraindication, which is actually not a contraindication, there's not enough research done on Tolib in pregnant women. And when a lady is pregnant, you do not want to take any chance. Since there is not enough research showing it is safe, it is preferable to avoid Tolib for pregnant women. So your main contraindication is warfarin, sedatives, and pregnant or lactating mothers. When it comes to side effects, you have nausea, vomiting, and diarrhea. A few people might have some amount of dizziness as well. It's rare but can occur. So, what are you waiting for? You know that your aim is to have happier patients. For happier patients, you know that your patients want less discomfort post procedure. And you are aware of an enzyme combination which delivers on that promise. To make it safe, it comes from a brand which more than 120 plus countries trust, who have years of experience when it comes to pharmacological medications. So why not prescribe Tolib and make your patients happier? I hope all you've understood the entire session and I'm here to answer your questions.
Participating doctors, you can type in your message in the chat box and we will directly reach to Dr. Satish. If you have any questions, you can type in the chat box. We have the participation till date. Thank you, Bangalore, for your participation. If you have any questions, you can type in the chat box. So far, I guess no questions. Thank you, Dr. Satish, for this insightful and wonderful webinar. Hope it helps everyone to understand Tolib in a better way and improve our practice as well. Help our patient to relieve pain, swelling in a better way. Thank you so much for joining in. Thank you, participant, for joining in.
Thank you, Dr.
Thank you.